Hello everyone, PharmaSave welcomes you to the Adverse Drug Reaction Training. Since adverse drug reactions may act through the same physiological and pathological pathways as some diseases, they're difficult and sometimes impossible to distinguish. This presentation will provide us with some steps that could be helpful in assessing possible drug-related adverse reactions. Caregivers, PSWs, and nurses have the most contacts with patients living in a retirement home, and therefore they play an essential role in identifying, reporting, and monitoring adverse reactions our clients may be experiencing. What is an adverse drug reaction? An adverse drug reaction is an undesirable consequence of taking a drug or health product. A side effect is another term that people use to mean adverse drug reaction. So what are some of the symptoms of adverse drug reactions, or ADRs, and how can we recognize if we're seeing one? Some of the common symptoms include skin rash, easy bruising, bleeding, headache, nausea and vomiting, diarrhea or constipation, confusion, breathing difficulties. There are many more ADRs that a client can experience. Some are rare and minor. However, some can be severe and life-threatening. As we mentioned earlier, ADRs can closely resemble the same pathways of other diseases, and since they can be difficult to distinguish, we're going to have to take a stepwise approach that may be helpful in assessing possible ADRs. The first step would be to ensure that the medication ordered is the medication that was received and actually taken by the patient at the dose advised. This goes back to the rights of medication administration and ensuring that we're dealing with the correct patient, medication, and time. If an adverse drug reaction is suspected, it's definitely helpful to go back and look at the MAR sheet to see if everything was done correctly. It takes some investigating to figure out what caused the ADR, and that's why accurate documentation is important. If an ADR is suspected, this needs to be recorded in the patient's chart with the date, time, and duration. Next, we want to make sure that the onset of this suspected adverse reaction was after the drug was taken, not before. We want to figure out if it's really the drug that is causing this reaction that they're experiencing. So discuss with the patient any observations they made about how they're feeling. Determine the time interval between the beginning of drug treatment and the onset of the event. Use relevant and up-to-date literature on drugs and their ADRs, and verify if there are any previous conclusive reports on this reaction. You can also draw on your own personal experience as a health professional. Health Canada is a very important resource for obtaining information on ADRs, and the manufacturer of the drug can also be a good resource to consult. And finally, report any suspected ADR to the person nominated for ADR reporting at your facility, or report it directly to Health Canada. So does the medication need to be stopped? In most instances, the decision to stop a medication suspected of causing an ADR will be the patient's decision. If the ADR is minor and it's something that the patient can live with, for example, a minor headache or constipation, then no changes need to be made to the drug treatment. And sometimes changing the time of administration can make the ADR more tolerable. An example of this is If a medication given in the morning causes drowsiness, we may be able to change the administration time to bedtime. Some ADRs can be more serious, and immediate action would need to be taken to prevent permanent complications or death. Some examples of more serious ADRs are bleeding or heart arrhythmias. So, if the ADR is an emergency, call 911. The course of action for all non-emergency suspected ADRs should be discussed with a coworker or manager. The decision may be to call the pharmacist to discuss options or to call the doctor to get a recommendation. Another option may be to monitor the client's ADR and make a decision at a later time. An example of when this would be appropriate is if a patient tells you that they have a headache, but there have not been any changes to their medications in over a month. The headache is likely unrelated to their medication therapy, so this would be a good time to monitor and then make a decision later. After changing, discontinuing the drug, or reducing the dose, you need to continue to evaluate the suspected ADR and monitor the patient's status. If appropriate, restart the drug treatment and monitor recurrence of any adverse events. Keep your eye on the patient and monitor how they're feeling over time. It's always good to consider and analyze any alternative causes other than the drug that could have on their own caused the reaction. So now that we know that an adverse drug reaction is an undesirable consequence of taking a drug or health product, and we know what to do if we suspect a minor or serious ADR, let's look at some of the causes of ADRs in this next section. The cause of an ADR will differ from person to person, drug to drug, and situation to situation. But some of the common causes of ADRs include the following. The patient could have an allergy to the drug. Maybe this was a known allergy and it was missed. And maybe this is the new discovery of an allergy to a drug. The patient may have a problem with the way the drug is formulated, and this has caused an undesirable consequence for them. For example, a patient may not be able to swallow tablets and needs an alternative method of consuming the drug. There could be a drug-drug interaction that is causing the patient to have an adverse reaction. Some drugs should not be taken in conjunction with one another. For example, escitalopram and quetiapine can cause QTc prolongation, which increases the risk of cardiac events. Some foods cannot be eaten when taking certain drugs. For example, a patient taking atorvastatin should not eat grapefruit because they can cause adverse drug reactions if consumed together. So it's always important to think of the full picture and consider even the food the patient has eaten. Again, it takes some investigating to understand why a patient is having a reaction. There could be a drug-environment interaction at play. For example, a patient could have started medication in the winter, but in the summer, the heat or exposure to sunlight can cause an ADR. Error. This could mean the wrong patient, the wrong drug, the wrong time. And even if you do have the right patient and the right drug and the right time, you could have the wrong dose. A dose that is too high could be the cause of an ADR. And lastly, the cause of the ADR might be related to the patient's medical condition. So it's important to have context on the patient and their history. In this presentation, we covered the definition of an ADR, some of the steps you can take to determine if a patient is really experiencing an ADR, some of the causes and ways to investigate the reason for the reaction. We discussed some of the resources where you can get more information, and we discussed who to report an ADR to. If you have any questions about anything, such as drug-food interactions, options for drug formulation, or just general information about any drug, you can always call us at PharmaSave and we'll be happy to help out. Thank you for watching.